Welcome to the Explainer. Today, we're going to take a daily chore, something we all do, hopefully, and turn it into a really powerful act of self-care. We're diving into the simple science behind a healthy smile, and I'm going to show you how just a few minutes a day can make a massive difference for your entire body.
Okay, let's just jump right in with the fact that might shock you. If you think brushing your teeth gets your whole mouth clean, well, think again. The reality is, even if you have a perfect brushing technique, you're only cleaning about 60% of your tooth surfaces. That other 40%? That's the blind spot. And that's where all the trouble really starts. So, first things first, let's fix the foundation. Before we can even start worrying about that missing 40%, we have to make sure we're absolutely nailing the 60% we can get to with a toothbrush. It really is all about the technique. It all starts with your tools, and honestly, there are only two non-negotiables here. Number one, a soft bristled brush. You might think harder is better, but anything more than soft can actually scrub away your enamel and damage your gums. And number two, fluoride toothpaste. Fluoride is absolutely key for making your enamel stronger. Just look through that ADA seal of approval. That's how you know you've got the good stuff.
Now, what's really fascinating about doing this right is that it has nothing to do with scrubbing harder. Not at all. It all comes down to one single crucial detail: the angle of your brush. This is the difference between just kind of pushing plaque around and actually getting rid of it. And this is it. This is the gold standard. It's called the modified Bass technique. So first, you angle that brush at 45 degrees, aiming it right at your gum line. That lets the bristles sneak just underneath where plaque loves to hide. Second, you use gentle circular motions, no sawing back and forth. Third, work your way around your mouth so you don't miss any spots. And finally, and this is a big one, do it for 2 full minutes. Seriously, time yourself tonight. You'll be surprised. Okay, here is a game-changing tip that's going to feel a little weird at first. When you're done with your 2 minutes of brushing, just spit out the extra toothpaste. That's it. Try really hard not to rinse with water right away. See, leaving that little bit of fluoride on your teeth gives it more time to work its magic, strengthening and protecting your enamel long after you've put the brush down. All right, so we have totally perfected our technique for that main 60%. But now we have to go after that huge, hidden part of your mouth where a toothbrush just physically cannot go. 40%. Let that sink in. That's how much of your tooth surface is left completely untouched if you are only brushing your teeth. It's almost half your mouth. We're talking about the spaces between your teeth, and that is ground zero for cavities and gum disease. So how do we get in there? The key, the absolute secret, is the C shape. Instead of just snapping the floss in and out, you want to wrap it around the side of each tooth, kind of like you're giving it a hug. Then you gently slide it up and down, making sure to dip slightly below the gum line. That motion is what physically scrapes the sticky plaque off. But what's the right tool for you? It doesn't have to be old school string floss. Floss picks are awesome for convenience, especially getting to those back teeth. And water flossers, they are fantastic for anyone with braces or bridges, just using a stream of water to flush everything out. At the end of the day, though, it comes down to a simple truth that you will hear from basically every dentist on the planet. Don't get hung up on finding the one perfect tool. The best tool is whichever one you will actually use consistently every single day. Consistency beats perfection every time. Okay, so we know how to do it right. Now we need to talk about the stakes. What actually happens when that plaque, especially in that forgotten 40%, is just left to its own devices, when it's left to party? The very first warning sign is called gingivitis. If your gums look a little red, a little puffy, or if they bleed when you brush, that's it. That's your body's alarm bell screaming that there's inflammation. But here's the good news. At this stage, it is completely reversible with good brushing and flossing. But if you ignore that alarm, it sets off a very clear, very predictable, and very damaging chain reaction. You go from having healthy gums to the warning sign of gingivitis, to the irreversible damage of periodontitis, and then eventually to the final outcome, losing teeth. And this is where the real damage kicks in. Periodontitis is when that inflammation gets deeper. The bacteria actually start to destroy the bone and the ligaments that hold your teeth in your jaw. So we're not just talking about your gums anymore. We're talking about the very foundation of your smile literally dissolving away. So what does that actually look like in practice? Well, your gums start to pull away from the teeth, which creates these little pockets that just get filled with infection.
You get permanent bone loss, bone your body can never regrow. Your teeth start to get loose, and eventually they can fall out. This is the #1 reason adults lose their teeth. And here's what is so critical to understand. This isn't just about your mouth. The bacteria and the inflammation from bad gum disease, they don't stay put. They get into your bloodstream. Research is showing stronger and stronger links to really serious health problems all over your body, like heart disease and diabetes complications. Your oral health is your overall health. So let's bring this all home. We've seen the right way to do it, and we definitely understand the stakes. It is time to reframe this whole thing, not as a chore, but as one of the best, easiest, highest return investments you can possibly make in yourself. If you only remember one thing from all of this, let it be this. Be consistent, not perfect. You don't have to be a dental hygiene robot every single time. What really matters is just doing a pretty good job consistently every day. That's what stops that whole downward spiral before it even begins. And how much time does this incredible investment in your long-term health actually cost you every day? Let's break it down. 2 minutes of brushing in the morning, 2 at night, plus about a minute of flossing. That's it. 5 minutes. 5 minutes a day to prevent pain, thousands of dollars in procedures, and serious health risks down the line. Which really just leaves us with one final thought. When you weigh the pain, the cost, and the serious health risks of doing nothing against just a few minutes a day, what's your answer? What is your health worth to you?